So in July 2025, a piece of legislation was signed into law. It's called the One Big Beautiful Bill Act. Okay. Most of the coverage of this bill has been political. This video is not, because buried in that bill is something that every family with an aging parent, they need to understand. So in that bill, Medicaid, as in the program that pays for nearly 2/3 of all nursing home residents in this country, is being cut. And it's not being cut entirely, but it is being cut by $911 billion. Granted, this is through 2034. That's still $900 billion. Okay. And that's a number that I got from a nonpartisan congressional budget office. So that's a nonpartisan source. And the cuts are starting to take effect right now. So today, what I want to do is I want to walk you through exactly what's happening, right? Why Medicaid matters for senior care in the first place, what's actually in the bill when it takes effect, and then what it means for your family in particular. My goal by the end of this video is for you to know more and understand about this more than 99% of the families with aging parents. I want you guys to be informed so that we can make better, more intelligent, and more intentional decisions. Okay? Welcome back to the channel. If this is your first time here, my name is Winston One Day. I'm currently studying for my certified in long-term care designation, my Georgia life insurance license, and I'm in the process of acquiring an assisted living community right now. So I'm deep in this world every single day, right? The operational side, the financial side, and most importantly, the human side. And if you're caring for your aging parents or you're planning ahead for your own care, I want you to hit that subscribe button, because I believe we're building something pretty special here. What I'm trying to cultivate is a community of people who refuse to be blindsided by the care system, a community of people who are able to plan early so that they can enjoy their later years. Okay. Now, quick thing before we get into this. I'm not your attorney. I'm not your financial advisor, your insurance agent, or your doctor. This is education on a major policy change and what it can mean for your family. Okay. For your specific situation, especially anything involving eligibility or law, I want you to talk to somebody, a licensed professional in your state. Okay. Cool. Let's go ahead and get into it. First, I think we should establish why Medicaid matters for senior care in the first place. A lot of families assume Medicare handles senior care, but it doesn't. And this took me a little bit to learn the differences between Medicare and Medicaid. And we cover that in another video. But Medicare covers acute medical care. Okay. Medicaid covers long-term care. That's really the main difference. That's the divide. Okay. Medicaid is by far the largest payer of long-term care in this country. I think according to the Center of Medicare Advocacy, nearly 67% of all nursing home residents rely on Medicaid every single day to pay for their care. Medicaid also covers about 20% of assisted living residents. And that's about 4.5 million Americans. Medicaid pays for their home and community-based care services. Literally, without Medicaid, the senior care system in this country collapses. I don't think most families realize how dependent the system is on it until, they're in it. Now, what's actually in the One Big Beautiful Bill Act when it comes to senior care? It's really three things to keep in mind. Okay. The first is the hundreds of billions of dollars that is cut from Medicaid over the next decade. Okay. The exact $911 billion number, that's from the CBO. That was the headline. It could be a little bit less. It could possibly be a little bit more. But regardless of what it is, states rely on federal matching dollars to fund Medicaid. So when the federal share overall gets reduced, states, they have three options, right? They can either cut eligibility, which makes fewer people qualify, which makes it harder to get these services in your state. They can also cut the services entirely, which reduces what's covered, or they can cut the payments to providers, which means that they're now paying nursing homes and home care agencies essentially less for the same work that they were doing. And I think in reality, what they'll do is a mix of all three. Okay. And obviously these have propagating ramifications, if I could say so. Okay. Now, the second thing in this bill is that the bill caps something called the provider tax. Okay. The provider tax is a tool that the states use to draw down extra federal Medicaid matching dollars. Okay. The bill reduces that cap from 6% to about 3.5%. Granted, once again, it phases over time, but it's fully effective by fiscal year 2032. That's not that far away. Okay. And that's for states that expanded Medicaid under the Affordable Care Act. Okay. Now, that probably sounds very technical, but this is why it matters. It means that states will have less money to spend on Medicaid services overall. And that includes long-term care. And we already know what will happen when states have less money to spend on Medicaid. Okay. Now, the third thing, the bill delays implementation of new federal nursing home staffing standards. So keep in mind, right, there was actually a research study done by UPenn that says that those standards could have saved approximately 13,000 lives per year. Those standards were literally designed to address the chronic understaffing in nursing homes. And if you're familiar with this industry, if you've ever been in a nursing home or an assisted living facility, or you've ever had your parents in one of these, you know that this industry has historically gotten away with operating at a terrible grade. Pardon my French, but piss poor. Okay, if I could say so myself, right? Operating at a D minus, maybe C minus, C plus at best standard. And a lot of that is due to the staffing. Okay. Now that the staffing is being delayed, think about this, right? What are these facilities going to do now with less staff? They're going to be run even more poorly. So this is kind of why it matters. Okay. And I think this is where it gets confusing, because the question is always, all right, when do these cuts take place? And it is phased. So some changes have actually started in 2026. Some will take effect in 2027 and 2028. For example, the provider tax cap, that's fully phased in by 2032. So some states have already actually begun adjusting their Medicaid budgets in anticipation for all of these phased changes that are coming. So for example, Idaho implemented a 4% across the board provider rate reduction for 2026. And other states are actually weighing something similar for 2027. So what this means for you is that these cuts aren't something to put off for a long distance of time, right? They're already happening in some states. And in most cases, they're getting worse. Now, if this is starting to feel a little bit overwhelming, I think that's a normal reaction. This is why we put together our free planning guide. It walks you through how Medicaid actually works for senior care. It walks you through what families need, what to plan for, and the questions to ask somebody like an elder law attorney. Okay, go into the description, grab the link. It's there. Now, I also want to talk about what this means for real families. Okay. And I want to frame this tenderly, because I know people that are affected personally by this situation, or will be affected personally by this situation. I hear these horror stories all the time. I talk to so many people about this. So let me give you my perspective on what this might mean and how to kind of get ahead of this. If your parent is currently on Medicaid for long-term care, there are a couple things that you should watch out for over the next 2 to 3 years. One is obviously going to be the reduced staffing in their facility, right? Because when these facilities receive less Medicaid reimbursement per resident, they're going to try and cut costs. The biggest cost for facilities is normally staffing. So they're going to lower their ratios probably to the state minimums. At True North, what we're building, we plan on almost doubling state minimums. But a lot of these facilities, to cut costs, they're probably going to lower their staffing to state minimums, which is obviously going to lead to more falls, which is going to lead to more bed sores, medication errors as well. And then what researchers also call a failure to thrive, right? This is where declines start to come from understaffed facilities. People just don't do well in these facilities. So what I want you to do is I want you to stay involved, okay? I want you to visit often. I want you to talk to your parents, get cameras in their rooms if you need to, right? Document your concerns. I want you to know your facility's state inspection report like the back of your hand, okay? 2, I want you to also look out for the possible facility closures because this is probably going to happen. Okay. According to a industry survey in 2025, 27% of nursing home providers said that if Medicaid funding is reduced significantly, they would actually have to consider closing their facilities down. Now, if your parent's facility closes, you'll have to find a new one. And it's often going to be during the Medicaid application process. Think about how stressful of a logistic situation this can cause. So please, I want you to have a backup plan, right? Know what other facilities accept Medicaid in your area, or if it's not too late, if this is something that you still have some runway for, maybe we look into private pay options by looking at solutions like long-term care, or what we can do to now get our parent into a backup facility of some sort. Okay. The third thing that might happen is a reduced home and community-based services program funding. Because if your parent receives Medicaid funded home care so that they can stay in the house, these services are particularly vulnerable. Okay. Home and community-based services are technically optional for Medicaid. Now, even though most states heavily rely on them, they're still easier to cut than nursing home funding. So if you're planning ahead, meaning that your parent isn't on Medicaid yet, but they might be in 5 to 10 years, the window for proactive planning, I think it matters now more than ever. Okay. So 2 things I want you to do right now. 1, start the conversation with an elder law attorney. And then also don't wait until your parent needs Medicaid, because the 5-year look back period, this is important. I want to mention this. The 5-year look back period means that decisions that you make today, they will affect the eligibility 5 years from now. Okay. So you should be looking at things like legal asset protection strategies, right? And a lot of these asset protection strategies, they'll only work if implemented well in advance. I can't give you any specifics, right? I'm not an attorney, but these are conversations that you should have with your attorney. Okay. Now, the second thing that I want you to do is I want you to start understanding your state Medicaid rules. Now, even though Medicaid is at a federal level, it's what's called a joint state, like it's a joint program. Okay. So it operates both at a federal and a state level as well, which means there are federal directives, but it's run on a state by state basis and the rules are different. Okay. So think asset limits, income limits, look back periods, coverage of home versus nursing home care and home care, all the stuff, right? Personally, I'm in Georgia. So what's true in Georgia is going to be drastically different than what's true and real and actionable in California or Texas and New York. All right. So please, it's a state by state reality. And I think this is where it gets a bit uneven because states that expanded Medicaid under the Affordable Care Act, they're now facing the deepest cuts because the provider tax limit affects them the most. Okay. States that didn't expand, they will still see some impacts, but they'll just be different impacts. As a matter of fact, some states are actually passing legislation to backfill those cuts with state dollars right now, while other states are just quietly reducing services, right? Like I mentioned Iowa earlier, right? Patient advocates have already reported that the state is quietly reducing in-home care services in response to those federal cuts. So please keep that in mind. Like these things are happening right now and it's active and the bottom line is where you live is going to matter more than ever for senior care planning, right? So what can you actually do about this? I think there's 3 things that you should do right now. Okay. The first thing is please don't panic, right? This is affecting everybody. And these changes are phased over years. So it's not like your parents' care is going to disappear tomorrow. No, what's happening right now is a slow tightening over the next decade. What this gives us the opportunity to do is plan early. Okay. Slow tightenings, they respond really, really well to early planning. Now, a crisis tightening, that forces emergency decisions. We don't want that. So please do not get caught up. I don't want to have having this conversation with somebody that should have watched this video in 4 or 5 years and they're looking at me like what can I do? Please, let's plan early. Let's get ahead of this stuff. Okay. 2, I want you to get your documents in order now, right? Power of attorney, healthcare directive, the will, inventory of assets, all the important contacts, right? If your parent has substantial assets, you should talk to an elder law attorney about asset protection strategies well in advance of these Medicaid needs. Think annuities, things long-term care, think life insurance, right? Whole lot. Think things like that, right? Talk to a professional to get well in advance information on this stuff. Okay. And then the third thing that you can do and that you should do is stay informed about your specific state. Because what Medicaid changes happen at the federal level aren't necessarily going to apply to you at the state level. States move a lot faster sometimes, and they move a lot differently than the federal level. So you should be signing up for alerts from your state's Department of Aging or Community Living or whatever. You should be reading the local news, right? Don't rely on the national headlines for your state specific decisions. Like I said, I'm based in Georgia. So obviously that's where I'm going to skew for most of my information. However, I'm not the only source that you should follow. You should follow, by the way, subscribe, do all that YouTube stuff. But you should also just, stay abreast of the information, right? Looking up the different things. Okay. So let's kind of wrap this up here. If I could summarize, once again, the Big Beautiful Bill Act, right? That's going to cut $900 billion in Medicaid through 2034. Medicaid, even though that's the largest payer of long-term care in this country, the cuts are happening. They are phased. Some are hitting right now. Some are going to be, more of them are going to come by 2032. If your family is currently on Medicaid, you should expect staffing reductions. You should expect facility closures. And then you should expect cuts to some home-based services as well. Now, for your families that are able to plan ahead, you should start working with an agent, an elder law attorney, and everybody in between while they're still planning runway. Okay. Also keep in mind that where you live matters more than it used to. You should follow your state or get information for your state as best as you can. Don't rely on the national headlines, please. Okay. And then the last thing you should do, grab our free planning guide. It walks through how Medicaid actually works for senior care. It walks you through what families need to plan for, and then the right conversations that you should be having with your attorneys and your legal professionals and your, licensed professionals. Okay. If you go to the description, the link is there. Grab that, download that link, start asking the right questions, having the right conversations. Now, whatever you think about the politics of this bill, that's not what this video was about. Like the practical reality is that these families that are affected by this, they need to plan with more intention than they used to. And that intentional planning, it starts with more information. Okay. So I'm Winston One Day. Once again, I want you guys to plan early. I want you to plan smart, and I want you to take care of each other. I'll see you in the next one. Peace.